Hi, I'm Karen Peak with Dave Waller, and today we're going to talk about myths about the flu. It seems like every season that these myths and misconceptions start piling up, and they actually spread as rapidly as the flu. So we're going to talk to some clinicians here at Deaconess and start dispelling those myths. Myth number one, which is, the seasonal flu is annoying but harmless.
No, the seasonal flu is definitely a more severe illness than your common cold. It includes sore throat, cough, high fever, myalgias, feeling bad, and typically is much more serious than just a regular cold.
I'm with Kelsey in the pharmacy, and we're going to talk about flu myth number two, which is there is no treatment for the flu.
Well, you're right, Karen, that is a myth. There is actually one medication that will help fight the flu. It's called Tamiflu. It's actually most effective when prescribed within 48 hours of symptom onset. It can also be used to prevent flu if you have someone in your household that has the flu that's been diagnosed. So it can be used for either indication.
Okay, very good. And is it true that this is also part of the same myth? Can antibiotics fight the flu?
No, antibiotics do nothing for the flu. Antibiotics fight bacterial illnesses, and the flu is a viral illness. So only antivirals like Tamiflu would work for the flu, whereas antibiotics are only for bacteria.
Dr. Stevenson is going to help us dispel flu myth number three, which is that the flu vaccine can give you the flu.
I think when you take the vaccine, you can get a slight reaction to the vaccine with some flu-like symptoms. But by that, I mean you get some malaise, sometimes some poor energy, those kind of minor symptoms of the flu.
Influenza is a miserable illness that just is incapacitating and causes a significant amount of discomfort. And so the first reason it's a myth is there's no reason to suffer with the flu. When you can have a flu vaccine that is safe and almost painless and can protect you from that severe illness. Perhaps more importantly than that is the population health benefit that there is of something called herd immunity. And that is the more of us who are walking around and are immune to the flu, the less able it is to pass person to person. And that can help protect more vulnerable people, perhaps in our household or that we encounter in our work or everyday life, because people are incubating and can transmit the flu quite some time prior to exhibiting symptoms. And so you can even be an unwitting passer along of that virus to someone who could suffer significant morbidity or even mortality from it.
Very good, because I think that's something we don't think about, is that we get the flu shot to help protect other people in our household. And so, okay, excellent point. Thank you very much. We're here at Deaconess Mary Street to dispel myth number 5, which is that the flu vaccine is dangerous. Sharon, could you tell us what your opinion is about that statement that the flu vaccine is dangerous and may cause developmental disorders in children?
Yes, there's no evidence that supports that the flu vaccine can cause anything in children. The fact is that the flu vaccine is very, very important. It helps prevent the flu, and then it also actually will help you if you do get the flu, make it where it's not as severe as it could have been. So it's a very good preventative action for all patients to actually talk to their physician and get a flu shot.
So you definitely would say that is a myth and that vaccines are dangerous.
Yes, that is a myth.
Doctor, our next myth is flu myth number 6, which is that the flu is only dangerous for the elderly.
That would be incorrect. It is dangerous for primarily the older and the younger patients. A lot of children are admitted with flu on a yearly basis. A lot of adults who take care of elderly patients also could expose their family members to the flu, so therefore I believe that all individuals should be vaccinated against the flu.
We hope that the information that you get today about the flu shots, if you haven't gotten your flu shot, will help you make that decision in getting one, because it is very, very important.